Hey, hey, hey! Welcome back to Following Science, where we delve deep into the pressing issues in healthcare, science, and public health. I'm your host, Rita Raparl, and today we're going to be tackling a provocative question. Is health insurance a scam? This question has been subject to much debate, especially in the United States, where the health insurance industry is both vast and complex. In today's episode, we're going to break down what health insurance is, how it works, the criticisms it faces, and whether those criticisms even hold weight. So, without further ado, let's get started. So, first, let's talk about what health insurance is. Because to understand whether health insurance is a scam, we first need to understand what it is and how it's supposed to work. So, health insurance is a contract between an individual and an insurance company. This individual pays a premium, and in return, the insurance company agrees to cover certain medical expenses. The primary purpose of health insurance is to protect individuals from high unexpected healthcare costs by pooling risk among a large group of people. Let's talk about different types of health insurance that exist. So, starting with employer sponsored insurance. This is insurance that is provided by an employer as part of their employee benefits. Oftentimes, this is pretty cheap, and it's often cheaper than getting individual insurance, which is when individuals purchase insurance directly from insurance companies. And it's cheaper because your employer is paying for a lot of it, or all of it, which is why it people often prefer to get a job that has benefits such as health insurance and other different types of insurances. And then there's also government programs such as Medicare, Medicaid, and in Children's Health Insurance Program, or CHIP, in the United States. And things like these government programs are used to benefit people that might not be able to afford health insurance or are super old and actually need it but might not be able to get it. Now, let's talk about how health insurance works. And to figure that out, we need to first discuss key terms because these key terms are what lead the entire world of health insurance. So, starting with premiums. Premiums are regular payments that are made to keep the insurance active. So, they can be monthly, yearly, stuff like that. Then there's deductibles. Deductibles is the amount the insured must pay out of pocket before insurance begins to cover expenses. And the thing for deductibles is the higher your deductibles, the lower your premiums in the future, which is why a lot of people often tend to pay really high deductibles so that they don't have to pay as much every time in their regular payments to keep the insurance active. And then there's also co-payments and co-insurance, which are partial payments made by the insured for covered services. And then there's network providers, and here, doctors and hospitals that have agreements with the insurance company use it to provide services at a reduced rate. Now, let's talk about some criticisms of health insurance. Now, despite its intended benefits, health insurance is often criticized. Now, let's examine some of these major criticisms that exist. Starting with high cost. One of the most primary criticisms is the high cost of premiums, deductibles, and copays. Many people struggle to often afford these costs even with insurance, which is why a lot of people often think that health insurance is a scam because it's asking for so much money from you for something that may or may not happen in the future. Second, complexity and lack of transparency. Insurance plans can be incredibly complex, with confusing terms and conditions. Many people often find it difficult to understand what is covered and what is not, leading to unexpected bills, which is also why a lot of people think health insurance can sometimes be a scam, is because they often don't read the very detailed terms and conditions, which may or may not include unexpected bills that they might have to just end up paying more for, which they didn't realize they were signing up for when they actually signed up for it. Third, limited coverage. Even with insurance, certain treatments and medications may not be covered. This can leave individuals with significant out of pocket expenses. This is also one of the biggest reasons why people think that health insurance is a scam, is because you're paying so much for something, and then in the end, you don't even get out of it what you need to get out of it. Like, for example, what if you have an incident where you're injured in a way and you need a treatment that's not covered by your health insurance, but you've been paying health insurance for a long time, right? That kind of stings, not being able to pay for your treatment through your health insurance when you've been paying for your health insurance for so long. And then there's profit motive. Critiques argue that profit motive of private insurance companies leads to higher costs and denied claims. Insurance companies may deny coverage for necessary treatments to save money, which kind of goes into my last point of limited coverage. But a lot of people think that it's because they want to save money or they just want to make an extra profit without actually like paying what the service is actually there for. And then there's bureaucracy and administrative hassles. Dealing with insurance companies can involve a lot of red tape and bureaucracy, which can be frustrating and time consuming for patients and healthcare providers. Because when you're going out and buying something, you're buying it to make your life easier, not harder. And sometimes health insurance can make your life harder because of all the time consuming things that surround it, such as like a lot of red tape part. Now, given these criticisms, it's really important to consider whether health insurance truly serves its purpose or if it operates as a scam. Now, the textbook definition of a scam is where it typically involves deceit and intent to defraud. For health insurance to be a scam, it would need to be systematically deceiving people into paying for something that they don't actually receive, which kind of happens when it doesn't provide the treatment that it's supposed to provide or the coverage for that treatment. But the thing is, for that, it's not technically intending to defraud because, in a way, it still did have the terms and conditions in their very detailed like notes or whatever you get when you buy these insurance policies. So when you're actually buying the insurance policies, you're agreeing to all of that, and that includes not getting covered for some of the treatments, even though you didn't exactly realize it at that point. So technically, the intention's not to deceive in a sense, and especially because if it was to deceive, then they would be hiding information or they would be withholding that information because then it would be like they're trying to fraud, and that's when health insurance would actually become a scam. Now, let's evaluate health insurance in a little bit more detail in a different way. First of all, let's talk about risk pooling and protection. Health insurance does pool risk and provide financial protection against catastrophic health expenses. This is a genuine service that can prevent financial ruin due to medical bills. Because medical bills can cause debt, y'all, and health insurance does prevent that for a long time if you got like, the right insurance plan, the right coverage, of course, taking all of that into account. Second, regulation and oversight. The health insurance industry is heavily regulated. And while there are issues, it's not entirely accurate to say it's a scam because regulations do exist in the end to protect consumers like you. Third, access to healthcare. Health insurance provides access to a network of healthcare providers and often covers preventive services, which can improve overall health outcomes. So, in the end, you might not even need that huge treatment because you've been getting the preventive services that some health insurance plans do cover. Fourth, consumer protection. Like I mentioned before, laws like the Affordable Care Act have introduced consumer protections such as prohibiting denial of coverage for pre-existing conditions and capping out-of-pocket expenses. So, consumers are oftentimes protected by different policies and laws. 5. Market failures. While not a scam, the health insurance market does have significant failures, including high costs and lack of universal coverage. And of course, these are systematic issues that need addressing. But honestly, if we look at it from a broad point of view, what industry is there that doesn't need fixing? Every industry needs fixing, and there are many ways to go about it. And right now, there's a lot of talks about how to improve the health insurance industry. So it's not like people are not trying to get reforms to happen, it's just they're still discussing how to do it. But of course, there are already so pre existing things like protection for consumers that exist to protect against all these market failures that may or may not happen. So let's talk about some reforms and alternatives that could happen in the current system, and things that have been proposed already to address these flaws. First of all, a single payer system. A single payer system like Medicare for All would involve the government covering healthcare costs for all residents. This could eliminate many of the issues with private insurance, such as profit motives and administrative complexity. Second, public option. A public option would provide a government-run insurance plan that competes with private insurers. This could drive down costs and increase coverage options. Third, regulatory reforms. Improving transparency, simplifying insurance plans, and increasing regulation all can be done to prevent price gouging and ensure fair coverage, which are just examples of some other potential reforms that could happen. So, as we wrap up today, let's reflect on the main question. Is health insurance a scam? Because while the health insurance industry does have a lot of flaws and can be incredibly frustrating for consumers, calling it a scam might just be an overstatement because it provides real benefits and protections, though oftentimes at high costs and with many complications. So, the key here is to recognize the problems and work towards meaningful reforms that can make health insurance more affordable, transparent, and effective for everyone. Now, as we wrap up today, I just want to thank you all for listening and tuning in to this episode of Following Science. If you have any thoughts or questions about today's topic, feel free to reach out. And until next time, I hope you guys stay healthy and informed. This is Following Science. I'm your host, Ritu Parl. And remember to subscribe and leave us a review if you enjoyed this episode. See y'all next time. Bye.